What if one of the medications you've been taking every day is quietly increasing your risk of falls, memory loss, confusion, broken bones, or even hospitalization, and you have absolutely no idea it's happening? Stay with me because one of the medications we'll discuss today is used by millions of older adults every single day, and many people never realize the danger until it's too late. In fact, one patient I cared for thought she was developing dementia, only to discover the real cause was hiding in her medicine cabinet. Before we begin, please subscribe to the channel and turn on notifications. Every week, I share practical, science-based health information designed specifically for adults over 60 who want to stay healthy, independent, and active for years to come. And while you're here, tell me your age and where you're watching from in the comments below. I love seeing viewers from all around the world, and your comments help build a supportive community where we can learn from each other. Now let's begin. One of the biggest mistakes I see as a physician is older adults continuing medications that were prescribed years ago without anyone ever reviewing whether they still need them. The original problem may have disappeared long ago. The treatment may no longer be necessary. Yet the medication continues day after day, month after month, year after year. The reason this matters is simple. The body changes with age. Your kidneys process medications more slowly. Your liver becomes less efficient at breaking them down. Your brain becomes more sensitive to medications that affect alertness and balance. At the same time, many older adults take several medications together, increasing the risk of interactions and side effects. As a result, a medication that seemed perfectly safe 20 years ago can become a hidden source of health problems today. One of the most serious consequences is falling. Many people underestimate the danger of falls. But for older adults, a single fall can change everything. A broken hip can lead to surgery. Surgery can lead to hospitalization. Hospitalization can lead to loss of strength and independence. In some cases, people never fully recover. That's why today's topic is so important. Let's begin with one of the most commonly prescribed medications for sleep. Sleeping medications such as zolpidem, often known as Ambien, and similar drugs are frequently used by people struggling with insomnia. At first, these medications can feel like a miracle. After weeks or months of poor sleep, finally getting rest feels wonderful. But the aging body handles these medications differently. They often remain in the system longer than expected. Instead of simply helping you sleep at night, they may leave you groggy, dizzy, confused, or unsteady the next morning. Studies have repeatedly shown an increased risk of falls and fractures among older adults taking these medications. What's even more surprising is that many people gradually become dependent on them. Over time, sleeping without the medication becomes difficult. The dose may need to increase. And yet, the amount of extra sleep these medications provide is often much smaller than most people imagine. Before I reveal medication number 2, let me ask you something. Have you ever felt unusually tired, dizzy, or foggy after taking a medication? If so, let me know in the comments because what we're about to discuss next may explain why. Medication number 2 belongs to a group called benzodiazepines. This includes medications such as Xanax, diazepam, and lorazepam. These drugs are often prescribed for anxiety, panic attacks, and sometimes sleep problems. There is no doubt they can be helpful in the right situation. During periods of intense anxiety or emotional crisis, they can provide significant relief. The problem arises when they are used long-term. In older adults, benzodiazepines can affect memory, concentration, balance, and reaction time. Many people describe feeling mentally slower or emotionally disconnected. Some experience increasing forgetfulness and mistakenly assume it is simply aging. Unfortunately, these medications can also become habit-forming. The body adapts to them. Stopping them suddenly can be dangerous and should never be attempted without medical supervision. One of my patients had been taking a benzodiazepine for nearly 15 years. She assumed her increasing forgetfulness was just part of getting older. After working with her healthcare provider to gradually reduce the medication, she noticed significant improvements in alertness and memory. The next medication may surprise you because you don't need a prescription to buy it. In fact, millions of people purchase it at supermarkets and pharmacies every year. Older antihistamines containing diphenhydramine are commonly used for allergies and sleep. Many people view them as harmless because they're available over the counter. But for older adults, they can be surprisingly problematic. These medications can cause confusion, blurred vision, dry mouth, constipation, difficulty urinating, and increased risk of falls. They also have what doctors call anticholinergic effects, which can interfere with brain function. Some research has linked long-term use of anticholinergic medications with an increased risk of cognitive decline. This doesn't mean they directly cause dementia, but it does mean they deserve careful consideration, especially when safer alternatives may be available. Now, before we move to the next medication, let me tell you about a patient I'll call Robert. Robert was 79 years old and had fallen twice within 6 months. His family worried he was becoming frail. They assumed age was the problem. But during a medication review, we discovered he was taking multiple medications that affected balance and alertness. Once his treatment plan was carefully adjusted, his dizziness improved and the falls stopped. The lesson is important. Sometimes what appears to be aging is actually medication-related. And the next medication is one that millions of Americans take every single day for blood pressure control. Hydrochlorothiazide, often called HCTZ, is a medication that helps remove excess fluid from the body. For many people, it is effective and appropriate. However, in older adults, it can sometimes create unexpected problems. Because it increases urination, it can contribute to dehydration, especially during hot weather, illness, or periods of reduced fluid intake. It can also lower sodium and potassium levels. When that happens, symptoms such as weakness, dizziness, confusion, muscle cramps, and balance problems may develop. Many people never realize their medication is contributing to these symptoms because the changes occur slowly. They simply assume they're getting older. But here's the surprising part. The next medication on our list may be causing even more dizziness and mental fog than many people realize. And if you're taking it for chronic pain, you'll definitely want to hear what comes next. Gabapentin and Pregabalin have become extremely common in recent years. These medications are often prescribed for nerve pain, chronic pain, shingles-related discomfort, and various other conditions. For some people, they provide meaningful relief, but they can also cause significant side effects, particularly in older adults. Dizziness, drowsiness, balance problems, mental fog, and slower reaction times are all common complaints. One challenge is that these symptoms often develop gradually. Instead of noticing a sudden change, people slowly adapt to feeling less energetic or less mentally sharp. They assume it's simply aging. In reality, the medication may be contributing more than they realize. The risk becomes even greater when these drugs are combined with sleeping pills, anxiety medications, or other sedating drugs. The effects can stack together, creating a much higher risk of falls and injuries. Now let's move to a medication that many viewers may be taking right now. Acid reflux medications such as omeprazole, pantoprazole, and lansoprazole are among the most commonly prescribed drugs in the world. They can be incredibly effective for treating heartburn and reflux symptoms. The concern isn't usually short-term use. The concern is that many people start taking them for a few weeks and continue for years without ever reviewing whether they're still necessary. Long-term use has been associated with vitamin B12 deficiency, low magnesium levels, and an increased risk of fractures in some individuals. Again, this does not mean everyone should stop taking them. The key question is whether the medication is still needed today. Many older adults cannot even remember why they started taking it in the first place. That's why periodic medication reviews are so important. Now we've reached the final medication on today's list, and honestly, this may be the one that worries me most because it's available almost everywhere. You can buy it in grocery stores, gas stations, pharmacies, and convenience stores. Most people think it's completely harmless. Anti-inflammatory pain relievers such as ibuprofen, Advil, naproxen, and diclofenac are among the most commonly used medications in America. They can be very effective for occasional pain relief. However, regular use in older adults carries significant risks. These medications can irritate the stomach lining and increase the risk of stomach bleeding. They can place stress on the kidneys, particularly in people who are already dehydrated or have existing kidney problems. They can increase blood pressure and may contribute to heart attack and stroke risk in certain individuals. What makes them especially dangerous is how familiar they feel. Because they're available without a prescription, many people assume they're completely safe. Unfortunately, that's not always true. Taking them every day for weeks or months deserves a conversation with your healthcare provider. Now let's step back and look at the bigger picture. Have you noticed a common theme throughout today's discussion? Again and again, we see the same risks: dizziness, confusion, memory problems, balance difficulties, falls, broken bones, hospitalizations, loss of independence. These problems often develop gradually, which is exactly why they're so easy to miss. Most people blame aging. They blame stress. They blame poor sleep. They blame themselves. Rarely do they suspect a medication that they've been taking for years. But here's something every older adult should know. There are 3 warning signs that a medication may be causing problems. First, you've started feeling more tired, dizzy, or unsteady than usual. Second, you've experienced 1 or more unexplained falls. Third, family members have noticed changes in your memory, alertness, or behavior. If any of these sound familiar, it's worth discussing them with your healthcare provider. It doesn't necessarily mean a medication is responsible, but it's certainly worth investigating. One of the most valuable health appointments you can schedule is a medication review. Bring every prescription medication, every over-the-counter product, every vitamin, and every supplement. Then ask 2 simple questions. Do I still need this medication? And do the benefits still outweigh the risks at my current age? You might be surprised by the answers. Sometimes the solution is reducing a dose. Sometimes it's switching to a safer alternative. Sometimes it's continuing the medication because it's still providing important benefits. The goal isn't to take fewer medications. The goal is to take the right medications at the right dose for the right reasons. Before we finish, I want to emphasize one extremely important point. Never stop a medication suddenly because of something you heard online. Some medications require gradual reduction under medical supervision. Stopping abruptly can be dangerous and may lead to withdrawal symptoms or worsening health problems. Always work closely with your doctor or pharmacist when making changes. Now I'd love to hear from you. How many medications do you currently take each day? Let me know in the comments below. And if you've ever experienced a side effect from a medication that surprised you, share your story as well. Your experience could help another viewer recognize a problem they hadn't considered. If you found this video helpful, please subscribe to the channel, give this video a like, and share it with a friend or family member. Every share helps us reach more people who may benefit from this information. Thank you so much for spending your time with me today. Take care of yourself, stay informed, stay active, and remember that protecting your health isn't just about the medications you start. Sometimes it's also about making sure the medications you're taking are still the right choice for the person you are today. I look forward to seeing you in the next video.